Welcome to a special podcast, a roundtable with journalists at Glacier Media with the Premier of British Columbia, David Eby. I'm Kirk LaPointe, publisher and executive editor of Business in Vancouver, vice president editorial at Glacier Media, and I'll be the host today. A reminder, we are on the unceded ancestral territory of the Coast Salish peoples, the Musqueam, Squamish, and Tsleil-Waututh. We're grateful to be their guests. Our single topic on this podcast today is the profound crisis involving opioid use in our province, the impact on our communities, on our people, the responses by our government in this chronic challenge. Premier Eby has agreed to field questions from our journalists across the Glacier Media chain, and he's not had any pre-knowledge of what he's going to be asked, so I thank him in advance for taking on this task. Premier, welcome today.
Thanks, Kirk. Good to see you.
Our first question today, Premier, comes from Maria Rantanen, and she's a reporter at the Richmond News, and she lost her son to this crisis. So I thought this would be an important person to start with our discussion today. Maria?
Hi, and thanks for taking my call. As you know, my son died on July 15th, as Kirk mentioned, of carfentanil that he picked up on the street. For a lot of families, it doesn't seem that there's a lot of urgency to address this toxic drug crisis, which is killing many loved ones. And my question is very blunt. How are we going to, or how are you and your government going to stop these deaths?
Thanks for the question, Maria, and obviously such a personal and profound issue for you and your family and so many British Columbians. We just got the coroner's numbers. 200 more families, friends, well, many more than that, affected by deaths in our province. And of course, people often who survive overdose survive but with profound brain injuries. And it's something we don't often talk about. It is a huge crisis. You're right to insist on urgent action from government at all levels. And I think, we're also aware that there's not an easy and available solution to this crisis. We're all grappling with it up and down the coast of west coast of North America. I've talked with the governors of Washington State and Oregon, as well as the premiers to the north of us and other premiers across the country. And the goal of our approach is to try to keep people alive to give them the opportunity to get into treatment. We know that our treatment network is not sufficient in the province. And so we have $1 billion in the budget dedicated to expanding that network further. The big barrier to us doing that is not financial or will. It's the trained professionals to be able to deliver the care and support that people need in recovery. But we're also deploying a health human resources strategy to train those folks, to get them in place. And I know none of this happens fast enough. One of the pieces, especially core to our focus, is around youth. We know if we can support people and get them out of addiction when they're young, we can save them from a lifetime of misery. And also, it's so tragic to lose someone as young as your son with a lifetime of potential ahead. And we're moving upstream. We have networks in schools now, and also the Foundry system. One of the things we heard from parents is if they can get services, it's not until they're in total crisis that those services are available. So we're trying to make them available earlier and sooner for interventions. But the core point in all of this, cold comfort to you and your family, and many families looking for support that still aren't able to get it the way that they should be able to in our province. Just my commitment to you and to everybody else in this situation. Our government will do everything we can to turn that around.
We're trying to limit ourselves to one question per reporter, but Maria, in your case, in your special case, I wonder if you have a follow-up question for the Premier.
What really I find surprising is that when COVID hit 3 years ago, we were able to shut down the world, and understandably so. And we saw so many measures put in place so quickly, and we were probably able to prevent a lot of deaths. Why isn't there the same level of urgency when we know that there are 6 or 7 people dying in BC of toxic drugs every day?
Yeah, I think it's an important question, Maria, and an important context because it is the other public health emergency that we face in British Columbia. There's not a distinction from a government perspective between the COVID public health emergency and the toxic drug crisis public health emergency. And it does require that kind of response. But also, it's important to note that significant and historic steps have been taken to try to find ways to address this crisis. I mean, it's hard for me to imagine that we would be in a place where police chiefs across British Columbia were calling for the decriminalization of drugs, for example, or that the province would be seeking that and that the federal government would grant it in an effort to find new ways to go at this crisis. And so, big and significant measures have been taken. And we also know it's not enough. The death toll and the toxicity of the drugs continues to go up. And the pandemic is an important touchstone because we were beginning to see some progress in the numbers pre-pandemic. But when the borders closed and it got harder to ship those drugs that were available, we saw the toxicity go up, the strength of these drugs go up when the borders were closed and it was harder to ship those drugs. And now they're more toxic than ever, and they're mixed with other drugs that make it harder to resuscitate people. So this is a moving target, an incredibly challenging issue.
Of course, we have a province-wide crisis here, and so we're going to go next to the Prince George Citizen and Arthur Williams. Arthur.
Hi. Premier, the Northern Health Region has the highest per capita rate of drug deaths in BC. And that was just confirmed by the BC Coroner's Service just today, actually, again this month. What is the provincial government doing to address the high rate of deaths in northern and rural communities?
Yeah, thanks, Arthur. And I think, when people think about this crisis, they often think about urban areas. They think about the downtown east side, or they think about cities, big cities in the province. Northern Health encompasses a large number of very small, very remote Indigenous communities where tragically we are seeing remarkable levels of overdose death in those communities. I was speaking to Chief French from Takla First Nation about the deaths in his community and the devastating impact that they're having. And particularly the deaths we're seeing in the north are disproportionately among the Indigenous community. So we've been working with the First Nations Health Authority around Indigenous specific treatment and intervention opportunities that focused on culture and healing as part of the response to the crisis, layered into some of the challenges that are present for anyone grappling with addiction, or the experiences many Indigenous people have had in our healthcare system that make them even more reluctant to engage with those kinds of services. So they really do need to be Indigenous specific responses. And the First Nations Health Authority has significant interventions and treatment resources that they are deploying to respond to this. And also I want to recognize that healthcare is a challenge generally in rural and remote areas, and particularly around issues of addiction. So what we're trying to do is move upstream wherever we can to address these issues by addressing conditions of life in these rural and remote communities, and to really avoid the situation of bringing people out of those communities into major centers, and where we're seeing some of these impacts, like in Terrace or in Prince George or in Trail, these regional hub areas. So we have initiatives like, and it sounds disconnected, but it's really not, the virtual bail program when someone gets into criminal trouble in their community. It would be the case that they would be flown often to Prince George, for example, to do their bail hearing. And then if they were released into a community where they didn't have any connections and often fell in with people. And if they had an addiction issue, it got worse. And if they didn't have an addiction issue, they would develop one as they lived on the streets in the community. So you're trying to keep people in community, trying to make life more livable in communities by building housing, by building up cultural infrastructure and supports in community for people as part of this response as well, because we know that there's such a connection there between the quality of life in rural and remote communities and levels of addiction, mental health, and other struggles that people might face.
For our next question, let's go to the Coast Reporter in Bromwell and Bairstow.
Hi. So in February, we had a fire at our largest shelter that meant the loss of 35 shelter beds and the overdose prevention site. The community stepped up with to supply temporary emergency shelter for about 20 people, but we're hearing that situation is inadequate. Given that the opioid crisis and the housing are inextricably linked, where is the emergency response funding and support for situations such as those, and specifically this one?
Yeah, that's thanks for that question. I'm not as familiar with that situation as you are, but the question is the same in many different communities where the demand for shelter beds exceeds the beds that are available. And in some communities, we've seen a fire in a low-cost rental building that, in a community where there is literally no give when it comes to housing. And so, an example of that was in Terrace. We saw a building where the owner died and the building was in an estate process and it wasn't kept up and the pipes froze, and then all of a sudden it became unlivable. The people who lived in that building were facing homelessness. And so what we've had to do, unfortunately and necessarily, is expand the mandate of the emergency response at the provincial government to include housing emergency. So on the North Shore, when there was a fire in a low-cost rental building, the Ministry for Emergency Management and Climate Resilience responded by renting hotel rooms to get people in so that they had a place to live. We had to work with the City of Terrace to go in. That was the Ministry of Housing that time, to do repairs in the building to make it livable, to prevent people from becoming homeless. We're willing to take those extraordinary steps, and on the specific issue that you asked about, I'm happy to look into it and let you know about what additional steps we can take to respond to the crisis in your community.
Okay, thanks, Bronwyn. For our next question, we're going to go to the Peak News Magazine and Braden Dupuis.
Thank you, Kirk, and thank you, Premier, for being here and doing this today. My question relates more to the safe supply side of things, and just wondering if the province has plans to expand free drug testing across the province. Obviously, a lot of people using drugs here in Whistler, and a very casual attitude towards it, maybe not really linked to addiction, and more so young people just experimenting on a season away. I know we do have free testing through our social service provider. I'm just not sure how many people know about it, how used it is, and just, is there any plans, I guess, to expand that free testing and make it more widely available for people?
Yeah, thanks, Braden. And this is the one that, I hear Maria's story, and I got a couple of young kids myself, and the number of times that I made a dumb decision, and the odds of them making a dumb decision when they're at a party or something, and the risk that they could be at of dying as a result of that is so awful and so alarming for so many parents, and rightly so. We have expanded the availability of drug testing. It is quite cumbersome, and it requires as I understand it, a big machine that basically analyzes the drug. And so you have to physically go there, you have to know it exists, you have to be willing to do it, you have to be willing to tell someone that you have drugs. And all of those steps are barriers for people to do that. There is certainly talk about testing strips where people can detect whether or not fentanyl is in the drug that they're about to use. We know that there are people who actively look for fentanyl, and they may be used to determine whether or not these are drugs that someone wants to buy. But in any event, any intervention that we can provide to minimize the risk of overdose, of accidental overdose, and keep them alive is critically important. So we're always looking at opportunities like that through public health. And one of the sectors in particular, Brandon, you talked about kind of people going up to Whistler and at a party or whatever. One of the sectors we're really looking at is the construction industry. We know there are a lot of people who use opioids to manage pain that comes from the very physical work that they do, and they are at significant risk of overdose. We see the disproportionate impact in that community. And so we're looking through public health for ways to respond to these specific and discrete groups in different ways, and we're going to keep doing that.
Thanks so much, Braden. Jennifer Thuncher of the Squamish Chief has our next question.
Thank you, Premier. My question is around youth particularly, and secure care or involuntary care. And some of the parents here who've lost children in Squamish to the opioid crisis, or who have children actively dealing with it right now, are really begging, I think, for secure care. There's stories I know you've probably heard about, young kids getting taken into the hospital and then let go and dying days later. And so I think their question through me would be, is there not a way to have some kind of secure care that is also colonially sensitive, Indigenous, rights and history sensitive, that could help them?
Yeah, thanks, Jennifer. I think that the best way to think about the government's approach on this and so many issues is the answer to the question, is it going to have the intended result? Is it going to work? And I'm very sympathetic to the calls for secure care and the need for parents to be able to say, listen, don't let this kid go, because this is the chance that we have to get them treatment. I've pushed on this with public health and with other officials saying, isn't this something that would really make a difference? And the concern that they have and the information that they have is that if we implement a system like that in the province, that it reduces the possibility and the willingness of people to go to a healthcare environment when they or their friends overdose. And that reduced willingness, and especially, you mentioned sort of cultural sensitivity, it's already challenging enough, the experiences young Indigenous people have had in the healthcare sector, to ask them to go to the hospital. But when there's an added risk that they might not be released if they do go to the hospital, the concern that everybody has is that they're not going to go, and that they're going to die as a result, or that their friends aren't going to take them, or that they're not going to call 911 for an ambulance or for emergency support. So that is the sole and continuing concern that prevents us from putting a system like that into place. If we could address that concern, if there was a way to do it, I'm open to it, but that is the one that that really prevents us from moving forward on that. And there's another group as well, which I'm not sure if someone's going to ask about, but in terms of involuntary committal generally for adults, and happy to talk about that too if that's helpful. But specifically on young people and secure care proposals, that's the reason why we're extremely reluctant to move in that direction.
Please expand upon the involuntary hospitalization issue, Premier, because we know it is a major issue out there.
Yeah, sure. So, there's another group that's been brought to my attention of people who show up in emergency rooms, and it's a group of people who, when they are resuscitated in the emergency room, and in some cases the resuscitation is quite sudden, they will leave the emergency room and go out and use fentanyl again and overdose again and be brought back to the emergency room on the same day. And that sometimes happens 2 or 3 times in a single day. Our emergency rooms are under incredible strain right now. People with heart attacks and strokes and all kinds of health challenges needing service. To have a person who's grappling with a serious health issue to the point that they're visiting the emergency room 2, 3, 4 times in a single day, and that our response is to say, well, we can't really hold them. There's nothing we can do. They're going to go back out into the community. We're probably going to see them again. I just think that we can do better on that particular issue. Specifically around involuntary care, we've expanded the ability to sign off on involuntary care for people that need hospitalization to nurse practitioners to take some of the pressure off physicians. We've given police new tools to provide information through their phones in advance to the hospital, so they spend less time waiting with someone that needs to be assessed for involuntary care. But this core issue of the people who are back and back and back again and again and again until they're seriously brain injured and hospitalized for the rest of their lives, or until they die. This is a group that I think we can do better, and I've asked for the Ministry of Mental Health and Addiction to look for ways that we can improve our care for those folks, reduce strain on our hospitals, and reduce the risk that they're going to end up brain injured or dead.
Thanks for following up on that. I know it's actually a very personal issue for you, given your background in civil liberties and how consequential this battle is for you. Ian Jakes of the Delta Optimist has our next question. Ian?
Thanks, Kirk, and thanks, Premier Eby, for joining us today. It's much appreciated. I got sort of a bit of a two-part question. I'd like to get your thoughts on increasing funding to existing publicly funded detox centers in the Lower Mainland. And then part two of that question, should each community south of the Fraser, so obviously including Delta, have detox facilities as well as standalone facilities just for youth?
So the short answer to that, Ian, is yes, absolutely. For people who are listening or watching who aren't as familiar as you and others on the call with the system, the requirement for a lot of places, if you're going to go in for drug treatment, is that you've been through detox, and a lot of people need to go through medically assisted detox to avoid serious health impacts of withdrawal, whether from alcohol or from other drugs. And a shortage of detox spaces can mean that it's not available for people. So we have dramatically increased the money available for treatment responses, including detox. One of the pilots we're working on with Providence Health is a system where someone who shows up in the emergency room at St. Paul's with an overdose can go directly into detox. No wait list, no calling a number, no waiting, no taxi ride, directly into detox at the site, from detox directly into treatment at the site, and from treatment at the site to either supportive housing or to a family or friend, and into a recovery community where they're able to connect with job training and so on. But to make it as seamless as possible when people show up at hospitals. So we're looking at not just increasing detox resources, and it's not just in Delta. Communities like Prince George and others are pushing for increased and Terrace, increased detox support. But how do we make it seamless so that we don't lose people in that journey between showing up in the emergency room and having that moment of clarity that they want to go into treatment, and they're able to just walk through a door in that facility and go into the detox. Oh, and youth-specific, youth-specific treatment expansion is a big focus. For all the reasons that I talked about when I was answering Maria's question. We believe that if we can intervene early with young people who are struggling with addiction, we're gonna have more success. So yes, that is work that is underway.
Our next question comes from three publications: Burnaby Now, News-Winster Record, and Tri-City News. Mark Falkenberg is the editor there. Mark? I think you're on mute, Mark.
Sorry, my question had been about those detox centers. So that was, in fact, already answered by the Premier. Thank you.
Okay, thank you. Let's go next to Alex Curiel on Bowen Island and the undercurrent. Alex, you there?
Yeah. Good afternoon, Premier. Thanks for joining us. My question builds a little upon an earlier one about the rural remote communities, and Bowen Island isn't so remote as some of them, but we are very small. And so I'm wondering how communities, say like under 5,000 people like us, are prioritized or even remembered when resources are being allocated to combat the opioid crisis. And then with that, making sure that the citizens of those communities have equal access to said resources.
Yeah, thanks, Alex. Great question. We'll get you information about services specifically available on Bowen, so that through staff, so that you have them. But delivering healthcare on our islands and in rural and remote communities is a challenge generally, and islanders know that. But we also know that particularly it's in rural and remote communities where we're likely to see overdoses lead to death or serious injury because of the nature of the communities and the need to access services. So we're trying hard to make sure that we have access to services throughout the province, including in the smallest communities, to respond to this health crisis. And you know, it's never at the level that we want it to be fully, especially in rural and remote communities. But we do need to, and we have been expanding those services through different ways. And one of the ways that we're doing that is by making sure that that even just basics like naloxone kits and training on how to use them are available in communities, much like we would do with an automatic external defibrillator to respond to a heart attack is available in even the smallest communities, that there are people who trained and know how to use them, that the healthcare workers that are in these smaller communities are prepared with the knowledge that they need to refer people to key services, and that social workers that are available are also prepared for the same. But it will likely continue to be the case that that for drug treatment, that people may have to do some travel from smaller communities. But when they do, we want them to be culturally appropriate and responsive to their particular needs.
All right,
so much.
thank you, Premier.
We're going to go to Andy Prest at North Shore News next.
Thank you, Premier, for meeting with us today. My question is related to cannabis as harm reduction. There's some preliminary research that shows that cannabis use lowers the chances of a person using more toxic substances, and that those who use cannabis as a form of harm reduction are more likely to stay in medical treatment for opioid addictions. But provincial pricing and sales can make it hard for users to access cannabis. Where does the province stand on the use of affordable cannabis as a form of harm reduction for opioid addiction?
Yeah, I'm not familiar with the research, Andy, that you're talking about, but what I do know is that the province is taking an evidence-based approach to this crisis. We're very dependent on the public health experts in this area, the experts in mental health and addiction treatment and support, to advise us on the best path forward. And to continue to monitor and adjust to respond to new developments in the field. And we know that there's a huge amount of research going on about how we respond to this crisis, because it's not just here in British Columbia, it's across North America and in different parts of the world that people are grappling with this. And so certainly if there are developments in different medications, including cannabinoids or others that assist in reducing the risk of overdose or managing addiction, then if that's where the evidence is pointing, then the province will absolutely be looking at those things, and we'll look to public health and to addictions experts for those kinds of recommendations.
So Premier, we're cognizant of your time. I just want to get one last question in as we conclude our conversation. And you spoke at the beginning about your personal relationship to this issue. And it's not just as the leader of the province, but it's as a father, it's as a member of the community with family, and so on. And I'm sure you have 1 or 2 degrees of separation of experience in some of the harmfulness of this crisis. Can you tell me, on a scale of 1 to 10 at least, how much optimism do you have that this crisis can be defeated?
Well, I guess, Kirk, it's on a day like today when we hear about 200 deaths, 200 plus deaths in British Columbia in a month, despite really significant measures taken by the province, and it's hard to have a sense of optimism about this crisis. But what I am optimistic about, and what moves my number up beyond a 1, is the shared commitment of British Columbians to try to take the action that's needed when we identify those opportunities to save lives and get people into treatment. There's huge support for it. When I meet with people, it doesn't matter if it's a family member who's lost someone or whether it's someone who doesn't have that kind of direct connection. There's where they say, yeah, you should try the things, you should take the actions, you should do the things that are needed to respond to this. You have our support for that. It could be intensive mental health and addiction supports, Riverview-like models for people who are really struggling. It could be detox and treatment and community. And it includes things like prescription, safer supply, to get between predatory dealers and people struggling with addiction. And that open-mindedness and that willingness to take those actions from British Columbians certainly increases my optimism that when we find the best path to reduce these deaths, we'll be able to really hit the gas and bring those numbers down. But it is a profoundly challenging issue, Kirk, as you know, and as all the journalists on this call know. But British Columbia is ready to take on that challenge.
Well, we want to thank you for your generosity of time today, Premier, and for the candid conversation. I hope that you'll come back and talk to us regularly in a roundtable setting where we can talk about issues that are of profound importance to this province like this one. So thank you again, and we wish you well.
You bet. Thanks, Kirk. Thanks to all the journalists for the questions.
Thank you.
I'm Kirk LaPointe, publisher and executive editor at Business in Vancouver, vice president editorial at Glacier Media. Thanks a lot for watching.